Dr. Bejamin Luft, the director of the Long Island Clinical Center of Excellence for the World Trade Center Health Program and a professor at Stony Brook Medical School, joins me now. Thank you so much for joining us. I think the one thing in the piece that really stands out is that he did not know he had cancer for so many years. Is that something that you see in your practice?
Yes, it's the nature of cancers. Cancers have a latency period of 15 years, 10 or 15 years, but it doesn't mean that the cancer hadn't been present. It's when it first clinically manifests itself. So many patients have cancers. It's not clinically evident, and it only manifests itself years later.
So really, they've been living with this for quite some time, and then by the time they come in to get treated, is it sometimes too late, or how do you move through treatment? Well,
that's exactly right, and I think that the most effective treatment is prevention.
Right.
And so part of the World Trade Center Health Program is we have a preventive cancer program where we screen patients for a variety of cancers and we monitor them for that.
Is there anything else that the clinic does that's beneficial?
Well, we do a variety of things. We treat patients for all World Trade Center related health conditions. Some of those conditions are easily attributable to 9/11, but others are conditions which are arising years later after the initial event, and it's only due to the initial impact of the various toxins on the body that causes these things to manifest themselves, such as cancer.
What are some of the most common symptoms you see and some of the most common diseases that you see come in now?
Well, patients that are, the most common diseases are the old diseases, the diseases that were associated with 9/11 from the get-go. Respiratory disease that progresses to possibly to chronic obstructive pulmonary disease, asthma, PTSD that then evolves into depression. Those are the most common problems. But I think it's important to always remember that the initial event caused a variety of events to occur within the body, a sequence of biological processes that give rise to a variety of other conditions, such as cancer. There are autoimmune diseases that people are recognizing with increasing frequency as well. We've recently described that a good number of our patients have cognitive impairment. They're not able to remember as well. So all these things are things that are not necessarily clearly evident or clearly related to the dust injury.
Right.
But they only manifest themselves later on in life.
Do you think we need to do a better job? I feel like every year, we discuss the anniversary and we have these types of conversations. Do we need to do a better job throughout the year talking about these types of issues and having awareness campaigns to get people in for screening and those types of things?
Well, it's always important. It's important to get, we see new patients coming into our clinic even now. We have a growth of about 5 to 10% new patients every year. It would be nice if we had gotten those patients from the get-go, so we know that our outreach is not as effective as it could be, or there's a reason why people don't come to the clinic. But I also think that it's important that this is really a model program. There are so many patients, so many people out there who are traumatized as a result of a variety of conditions. Our vets. I think this program has really shed a lot of light as to what was happening to our vets. We've gone through many wars where our vets weren't taken care of. And I think that, when people start seeing what happened in this program, the research that's being done, it reflects on what happens to other populations as well.
Absolutely. Well, thank you so much for your work. And Dr. Bejamin Luft, thank you so much for being with us today.
Pleasure.
We appreciate it.